McKesson push-button blood collection sets are designed with a single-handed, in-vein needle retraction system that reduces the risk of needle stick injury. Depress the button with the black arrow to retract the needle into the needle hub. An audible click will signal that the needle is retracted into the needle hub and withdrawn from the vein. Single-handed activation retracts the needle instantly from the vein into the needle hub to minimize sharps exposure. Ultraflow needle cannula increases flow rate 170% in 23 gauge and 125% in 21 gauge compared to standard butterfly needles. Improve patient comfort. Use 23 gauge instead of 21 gauge without compromising flow rate. Needle bevel design requires lower penetration force than standard cannula, providing a more comfortable patient experience. McKesson push-button blood collection sets feature flexible, textured wings for easy handling, soft, kink-resistant tubing, and are available with or without a tube holder. Select the needle gauge depending on the patient condition, such as age, weight, pre-existing conditions. Physical characteristics of the vein, such as size, location, and accessibility. For blood collection, the volume of blood needed to be collected. The following are recommended needle gauges for venipuncture for different age groups. Needle gauge is easily identified by wing color. Green 21 gauge is recommended for adults. Blue 23 gauge and orange 25 gauge are recommended for adults, pediatrics, elderly, or patients with small, fragile veins. Be sure to always wear proper personal protective equipment according to your facility's guidelines. Open the peel-apart blister packaging and remove the device, being careful not to press the button on the top of the device. Check that the male multi-sample lure adapter is firmly attached to the female lure connector by pressing the adapters together. Do not twist. Wrap a tourniquet around the arm above the insertion site. Palpate the site to locate the vein. Disinfect the insertion site utilizing a circular motion. Twist to remove the needle's protective sheath prior to needle insertion. Anchor vein with your non-dominant hand and insert the needle at a shallow angle, holding on to the wings of the needle hub. Watch for a flashback of blood to confirm that the needle is in the vein and ready to draw blood. Remove the tourniquet once good blood flow is established. Place an absorbent pad over the insertion site. Do not press on the site until needle is removed. Keep fingers away from insertion site. Make sure the tubing is not blocked by the fingers. Depress the button with the black arrow and the needle will retract into the needle hub covering the contaminated needle. Apply pressure on the insertion site to stop bleeding. Dispose of the device according to your facility's guidelines into a designated biohazard sharps container.